In the last 10 days of the exam, you should be revising the past year topics because these topics have a high probability of being asked. Now, in this video, I will not be discussing the MCQs, but year-wise, based on the MCQs that have been previously asked, I will tell you what are the important topics. So let's start. In this video, I'll be discussing anatomy. So the question paper of year 2020-21. In this, the first question that was asked was injury to dash nerve results in winged scapula. Now this is a question from nerve injuries. This question makes nerve injuries an important topic. So now you need to know both peripheral nerve injuries as well as brachial nerve injuries. Under brachial nerve injuries, you need to know Klumpke's paralysis, Erb's palsy, injury to the long thoracic nerve. Then in peripheral nerve injuries, you need to know about the nerve injuries of the upper limb as well as lower limb. So what will be the clinical presentation? What will be the deformities that will be seen? All you need to know. Next question is lateral rotator of shoulder joint is. So in this, the action of the muscle has been asked. Similar question has been asked after that, muscles supplied by femoral nerve. So this makes muscles, their action and also nerve supply an important topic. So you need to know the muscles, action and their nerve supply of the upper limb, lower limb, muscles of the mastication and the face. Next is cranial nerve nucleus located at level of inferior colliculus of midbrain is. So they have asked the location of the cranial nerve nucleus. So this makes location of cranial nerve nuclei an important topic. Now, because the question has been asked from cranial nerves, you need to know about all the cranial nerves. You need to know the nerve supply. Also, it is good if you know about the lesions of those nerves as well. Next is dash is a fixed arch. So they have asked about the arches. So the arches of the feet as well as the hand, they are important, and the pathomechanics. If a particular arch is affected, then how will the patient present? So this was about 2021. In 2021, these were the questions from anatomy, and to summarize the topics that have been asked, the questions that have been asked are from the following topics: nerve injuries, muscle and their action, location of cranial nerve nuclei, and about the arches. The next paper is 2020. So in this, the first question is muscle with double nerve supply. So there are certain muscles with hybrid nerve supply. So again, if you know about the muscles, their nerve supply and action, you will be able to answer this question. Next question, muscles supplied by superior gluteal nerve. So again, this question is from the similar topic. Next question, muscle that locks the knee joint. So 3 questions in this year have been asked from one topic, which is muscle, their nerve supply and action. So this becomes a very important topic and you cannot miss it. Next, example of partly synovial joint. Now this is from the topic that is there in general anatomy, classification of joints. So there are various classifications. You need to know the types and the examples from each of them. Next question, if axillary nerve is affected, what muscle could laterally rotate the humerus? So now if you remember, in 2021 a similar question was asked, which was lateral rotator of the shoulder joint. So it is very similar to that, but over here the nerve supply has been asked, and in the 2021 question paper, the action and the name of the muscle was asked. So if you know that table for all the regions, upper limb, lower limb, you will be able to answer this question very easily. Next question is, if axillary, this is done. Next is most common site for ulnar nerve injury. So again, nerve injuries. the site of injury is important, and when you are doing radial nerve injury, ulnar nerve injury, all the peripheral nerve injuries, the site of lesion becomes important because the clinical presentation will change accordingly. Next, Brodmann number of Wernicke's sensory speech area. So now they have asked a question from functional areas of cerebral cortex. Now this is also an important topic because many questions have been asked in the previous years from this particular topic. So you need to know the functional areas of the cerebral cortex in all the lobes. There are different functional areas. You need to know the name, you need to know the number, and what will be the clinical presentation if there is a lesion in that area. Next, pointing index lesion of pointing index lesion is seen in which nerve injury? So again, a question on nerve injury. So nerve injuries is an important topic. Next, Wernicke's speech area is present in dash gyrus. So again, this question is on functional areas of cerebral cortex and they have asked the location. So as I said, the location of that particular functional area, where is it, in which lobe is it, and there are different gyrus, so you need to know pre-central, post-central, all that. Next, ataxia of trunk seen in lesion of which part of cerebellum? So this question is from neuroanatomy. You need to know the parts of the cerebellum and their function. So in 2020 question paper, the topics from which questions have been asked are muscles and their nerve supply, nerve injuries, classification of joints, functional areas of cerebral cortex, and parts of cerebellum. So these are the topics that you cannot miss. Then 2019, the first question is on bronchopulmonary segment. Bronchopulmonary segment contains dash. So this is where you need to know about the thorax. Then anterior interventricular groove contains dash. So you need to know the blood supply of the heart. So first is bronchopulmonary segment, second is blood supply of the heart. The different bronchopulmonary segments you need to know. Then sorry, not about the different bronchopulmonary segments, about the different lobes also you need to know. Then next question is superior radioulnar joint type. So you need to know about the types of joints. Again, this is similar to the one that was asked in 2020, which is about the classification of joints. So in that, it was asked about whether the joint is partly synovial, which joint is partly synovial. But over here, it has been asked that what type of joint it is. So again, a different classification of the joint is asked. Then anatomical snuff box is formed by. So a question on anatomical snuff box. So anatomical snuff box becomes important. You need to know the contents. Then 37, question number 37 is similar to the question asked in 2020. In 2020, the question 39, if axillary nerve is affected, what muscle could laterally rotate the humerus? So the questions are repeated, and therefore it is important that you do the past year topics very nicely. So again, this is on the nerve injury. Not nerve injury, but you need to, this is about the nerve injury. Then next question, supply to the tongue affected by facial nerve palsy. So again, facial nerve, you need to know the muscles supply. That is it. So in 2019, the questions have been asked on bronchopulmonary segment, on the blood supply of heart. Again, classification of joints is important. The different classifications you need to know and the examples from that. Then anatomical snuff box and facial nerve and its muscles supplied. In 2018, the first question is again on the functional areas of cerebral cortex. So the first question is, dash gyri is located in primary somatosensory area. Next question is nerve affected in wrist drop. So again, nerve injuries is an important topic. Next, nerve supply of temporalis muscle. Again, muscle and its nerve supply, that becomes an important topic, and I had said that muscles of mastication are also important. A question has been asked in 2018 on it. Next question, muscles supplied by deep fibular nerve. So again, muscle and its nerve supply is important. Next, structures passing beneath the flexor retinaculum. Now you need to know the structures that pass beneath the flexor retinaculum, that pass above the flexor retinaculum. You need to know about the carpal tunnel, because this question has been asked earlier also. Then the question in 2018 43 is similar to the one asked in 2020, that is question number 64. So you see how frequently the questions are repeated. Again, this is on nerve injury. Pointing index lesion is of which nerve? So nerve injuries and its lesion becomes nerve injuries becomes an important topic. Next, lower plexus injury refers to injury of dash. So again, this is a question from brachial plexus injury. So to summarize, in 2018, the questions have been from functional areas of cerebral cortex, muscles and their nerve supply, structures passing beneath the flexor retinaculum, and brachial plexus injury, that is Erb's palsy. Over here, lower plexus injury has been asked. Then in 2017, first question, anterior surface of liver is related to dash. So about the different surfaces of liver you should be knowing. Next question is, precentral gyrus of superolateral surface of cerebral hemisphere contains dash functional area. So again, this question is from functional areas of cerebral cortex. That is it. In 2017, only 2 questions were asked. In 2016, the first question is on, again, obturator nerve, the muscles supplied. Second, dash nerve can be rolled against the neck of fibula. So again, a question of nerve and the muscle supply. Next, site of injury of Erb's palsy. So again, the nerve lesions is an important topic. Next, articulation of talocrural joint is asked. So you need to know about the different joints. You need to know what type of joint it is. What is the articulation? So in 2016, the questions have been from muscles and their nerve supply, then about the articulation of the joint, and one question is on Erb's palsy, so nerve injuries. In 2015, the first question is, which muscle causes unlocking of the knee? Then the second question is, branch of posterior cord of brachial plexus leads to. So which is a branch of the posterior cord of brachial plexus? So that's it. Only 2 questions are asked in 2015. Again, these are from the similar topic, muscles and their nerve supply and nerve injuries. In 2014, first question is, claw hand indicative of dash nerve lesion. Nerve supply of abductor pollicis brevis, and that's it. So again, in this nerve lesions, muscles and their nerve supply, only these are the topics from which questions have been asked. So now I have discussed all the topics from which the questions have been asked in different years, and if you have noticed, the topics have been repeated. Only from a few set of topics every year the questions have been asked, and that is the reason why you need to know and revise these topics thoroughly, because these topics are the ones from which questions in the future have a high probability of being asked. So to summarize, what were the topics? Muscles and their nerve supply and their action. So in BD Chaurasia for upper limb, lower limb, then facial muscles and muscles of mastication. A table has been given, so you need to know those tables thoroughly. Next, you need to know about the nerve injuries. Different nerve injuries, again, as I said earlier, peripheral nerve injuries and brachial nerve injuries. Then about the functional areas of cerebral cortex. These are the topics which have been repeated frequently